Good evening, everyone. I'm Riley King, and welcome to my evening news report right here on the Riley King Network. Let's begin. First doses of COVID-19 vaccine arrive in New Hampshire, earmarked for long-term care, high-risk hospital workers. Vaccine expected to be administered to those at high-risk settings tomorrow. The first dose of a COVID-19 vaccine arrived Monday in New Hampshire. The shipment from Pfizer was being unloaded and processed. State health officials said they plan to begin distributing the vaccines to at-risk healthcare workers involved in the direct care of patients with the coronavirus in hospitals and long-term care facilities. The first doses are expected to be administered within 24 hours. New Hampshire has had more than 9,900 COVID-19 cases in December alone, representing about 32% of all cases over the course of the pandemic. Getting the vaccine is not mandated, and there is no system in New Hampshire to track who has received it. Governor Chris Sununu said the arrival of the first batch of the vaccines is the start of the end of the crisis, but he said it will still be months before life starts going back to normal. Today is a day that I think a lot of us have been waiting for quite some time. And if you had asked me 4 or 5 months ago if a vaccine was going to be here before June 1st, I would have thought you were crazy. But let me tell you, you got it done. They got it done, he said. Sununu said the vaccines are being distributed statewide on a population in popularity basis to hospitals, Walgreens, and CVS pharmacies. We have a system now that keeps track of what the need is, Sununu said. So everyone lets us know what they need, and depending on how much we get from the federal government, we just distribute out to pro-rate share to each of those facilities. This week, and then another shipment will come over and come out the next week. Phase 1A of the state's COVID-19 vaccination program is aimed at the high-risk population for both acquiring the virus and dying from it. Of the 12,675 doses now in the state, 7,800 are set aside in order to activate the federal long-term care facility program that starts next Monday. The rest are set to go to hospitals this week. Those hospitals can start ordering vaccines today, and we will provide it to them when they're ready to receive it, and they have clinics scheduled, said Dr. Beth Daly, Chief of Bureau of Infectious Disease and Control. All 100,000 people in Phase 1A are expected to be vaccinated by mid-January. Phase 1B is in the planning now and is geared for adults living in congregated settings such as senior housing and for high-risk individuals. And that does it for this evening news report right here on the Riley King Network. I'm Riley King, and thank you for watching this evening news report. Have a great rest of your evening, and see you back here tomorrow for another news report. Good night and goodbye, everyone.